What is a hair transplant? What are its techniques? How does it work? How about the results and prices? Is a hair transplant a permanent procedure? What are its advantages and disadvantages? Let's go through this video together, and don't forget to like and subscribe. Hair loss is a common problem that we may confront in our lives. Hair loss varies from person to person. Some people have total baldness that extends across their scalp, while others experience minor hair loss, such as a receding hairline or a decrease in density in certain areas of the scalp. There are various causes of hair loss that vary from person to person, including stress, genetics, and hormonal factors. Hair loss can have a psychological effect on people, generating feelings of loss of self-confidence and frustration, as well as a negative impact on their social lives. As a result, it is necessary to put an end to hair loss through a hair transplant. What is a hair transplant? A hair transplant is a minimally invasive operation performed under local anesthesia that involves removing hair follicles from the donor area, which is the back and sides of the head, and transplanting them into bald areas known as the recipient areas. A hair transplant seeks to get rid of the baldness over the top of your head and restore healthy hair. A hair transplant is also regarded as an effective treatment for those who have hair thinning or a receding hairline. What are hair transplant techniques? In general, the number of follicles transplanted depends on the size of the baldness area. However, at our clinic, we use modern techniques that allow us to implant as many hair follicles as possible while ensuring the proper depth and direction. Take a look at our hair transplant procedures. FUE techniques. FUE is an abbreviation for Follicles Unites Extraction. A popular technique involves picking hair follicles from donor areas one by one with a micromotor and transferring them to bald spots. It employs fine surgical blades to open extremely small channels in the recipient locations. The FUE hair transplant at our clinic consists of two sub-techniques. 1. Sapphire technique. The sapphire procedure is a specialized FUE treatment that uses medical blades made of the valuable stone, sapphire. The patient no longer has to be concerned about the procedure by relying on this type of blade. Because of sapphire's nature, it causes no damage or scars as the doctor makes tiny incisions in the scalp. As a result, it is completely risk-free and highly recommended. 2. Berlachtan technique. Berlachtan method is a modern FUE technique which aims to create very tiny channels using a microneedle made of titanium, unlike the classic FUE technique which is based on steel blades. By those fine titanium needles, the Berlachtan technique can ensure safe transplantation with natural hair direction and depth. DHI technique. A DHI technique, which stands for direct hair transplant, is one of the most recent hair transplant technologies. It has proven its potency in providing great outcomes for those suffering from hair loss. DHI is based on a magnificent implanter known as the Choi pen, which allows the hair transplant specialist to make tiny channels while implanting the graft. The specialist loads the implanter's hollow needle with the graft gently, implanting it with just one click on the plunger. The operation usually requires a couple of Choi pens and several needles for the implantation process. With DHI, the patient can get a fast recovery and ensure no damage or scars due to using the Choi pen. Furthermore, because DHI does not require shaving the recipient region, it is a good option for persons who prefer to keep their hair long. Who is a good candidate for a hair transplant? A hair transplant is not something that everyone can do. There are several basic requirements that the ideal candidate should meet. The patient should be over 25 years old. The patient should be in good general health. The donor area must be adequate to compensate for the baldness area. The patient should suffer from hair loss, baldness, or hairline receding. Pre-op hair transplant instructions. Before the surgery, the candidate should follow the following instructions to ensure a successful operation with favorable results. If the patient is a smoker, he should stop smoking for at least 3 to 4 days before the procedure. Smoking has a negative impact on the outcome of the procedure. Furthermore, smoking is prohibited for a few days following the operation. Then the patient can gradually resume smoking. Blood-thinning medications or drinks like green tea should be avoided for a week before the procedure, preventing the patient from severe bleeding during the operation. Certain medicines must be stopped, including aspirins or anti-inflammatory drugs, for at least a week before surgery. The patient should stop drinking alcoholic beverages and caffeinated drinks, including tea and coffee, for 3 days before the procedure. B or E vitamins or any type of multivitamin supplement containing B or E vitamins must be refrained for a week before the surgery to avoid excessive bleeding during the operation. How is a hair transplant done? The hair transplant begins with drawing the hairline and defining the number of hair follicles that are needed for the patient. The scalp is exposed to several important medical testings, such as blood and dermatological checks. Through these tests, the doctor can determine whether or not the patient is a candidate for hair transplantation. 3. Next, if the hair transplant is performed using the FUE technique, then the patient's head should be shaved to make the process easier. However, in the case of the DHI technique, only the donor area is trimmed, allowing the doctor to precisely pick the hair follicles. Following that, the patient will be given local anesthesia, which will keep him comfortable during the procedure. At this stage, the doctor employs a micromotor device to extract the target follicles from the donor area, one by one. Finally, the FUE technique differs from DHI technique in terms of the implant process. The doctor uses sharp blades or thin needles to open microscopic channels, then manually implants the grafts in the recipient area one by one. Hair transplant recovery. After your operation, your scalp will be covered with bandages for at least 2 days to avoid infection in the donor area. Your doctor will prescribe some medications, including antibiotics for many days, to promote your recovery and ease your pain. You'll be able to go back to your routine activities within 5 days at most. You should not be worried if your new transplanted hair falls out during the first 3 weeks after the operation. This shocking loss is temporary and just a normal part of a hair transplant. While you will notice your hair starts to grow in a few months, you'll be able to see almost 60% of your final results in 6 to 9 months. The final FUE hair transplant results will be seen a year after your surgery. Post-op hair transplant instructions. Here are some important aftercare tips which will help ensure ideal results as quickly as possible. Take the medications which are prescribed by the doctor. They will help you get well. Keep wearing the head bandage for 2 days after the procedure. Don't wash the hair or have a shower for 3 days after the procedure. Try to keep the head straight as possible and sleep in a semi-vertical position for 5 days. Avoid sun exposure and bad weather for 3 months after the procedure. Don't swim for 3 months after the procedure. Avoid smoking for 3 days after the transplant. Stay away from strenuous physical activities for at least a week. If you are a bodybuilder, you must avoid exercise for a month following the operation. Hair transplant side effects. A hair transplant might be associated with the following common side effects: scalp infections, bleeding around the microsurgical incisions in the first days after the operation. Scalp itching is a natural reaction to the body's healing. Bruising, swelling, and pain around the scalp. Inflammation of hair grafts. Numbness or loss of sensation around the surgical incisions. Of course, we cannot be sure if those complications or side effects will occur or not. So if you experience such symptoms, we advise you to consult your doctor. Is a hair transplant painful? The level of pain experienced during the treatment varies from person to person. However, the pain is typically felt for 30 seconds at the beginning of the operation while receiving local anesthesia in the donor area, and another 30 seconds while your baldness areas are numbed locally. So the pain is not long-lasting. Is hair transplant permanent? Your hair transplant results will last a long time. However, if you want to strengthen and grow your transplanted hair grafts powerfully, you should have PRP sessions that include numerous vitamins as well as mesotherapy and medicinal shampoos. Hair transplant cost in Turkey. When you are thinking about performing a hair transplant, Turkey should be on your top priority countries list. Turkey is one of the best destinations in the world when it comes to hair transplant costs. In comparison to European countries and the United States, hair transplant costs in Turkey are considered affordable. Of course, it has nothing to do with the quality. Turkey is full of reputable cosmetic clinics which offer high-quality medical services at very reasonable prices. There are two crucial reasons behind the low hair transplant cost in Turkey: the low cost of living and the continuous Turkish lira depreciation against the dollar. A hair transplant cost in Turkey ranges between 900 to 1,500 euros, according to the technique used and the size of the baldness for the patient.